as introduced, I'm a pharmacist specializing in migraine, and I have been doing this now for only specializing in migraine for almost 3 years, where I give services in Canada and around the world in education and also in that direct patient care for people living with migraine. Migraine is this. I mean, I know you know this, but I'm just going to just tell you where the thought process comes from. It's a community condition. It's a condition that does not need to be in hospitals. It doesn't need to be in specialist offices unless we fail in the community. At this point of time, we know we're not doing a great job in a community practice, whether at the GP offices or family physicians or even pharmacists. And this is why we're trying to bring it back to the community where it needs to be managed properly as soon as it is identified. It's a neurological disease. The closest condition to migraine is epilepsy, believe it or not, but it's never treated in the same way or the same serious relationship with the doctor is totally different. If you come in with migraine, most of the time it's underestimated, underdiagnosed, undertreated, and a lot of times this similar to Canada, but I have talked to physicians and to patients around the world, and the experience is usually that it's just a headache. We know it's not just a headache. We know that this is a neurological disease. Pharmacists are very often approached by patients who do request assistance when choosing a headache medicine. If you go in and you have, you would like, most of the people can go in, get something, and if they get relief by it, they're okay. But I do see every day patients who come in and they say, I need something better. I need something that works, longer, or that does not have as many side effects. And we also help patients when they get a prescription medication, because we do explain to them how to take them, and we also help them communicate for prevention, and we do explain prevention and acute medication. So I don't know if in Ireland you're using acute and prevention. So acute is when you have an attack, when you have a headache hitting at the time, you need an acute medication, or sometimes they call it an abortive medication. In preventive medication is something that you would take every day or every month, now that we have all these new options, or even every 3 months, to prevent you from having a migraine attack or a migraine headache. Pharmacists can recognize headaches that are responsive to self-treatment, the ones that we can just show you where it is on the shelf, or we give you from behind the counter, or those that we can tell you that this one, actually, you do need to go see someone. We can tell you, you can book an appointment with your family physician, or we can tell you, this is an emergency room situation. So it's really important when you have a headache to, if you're worried, if you're not sure, it's a very good idea to go and seek help from your pharmacist. Of course, you're not just a headache. You're a human being with all the organs. There's something called comorbidities, and we find that migraine is accompanied by a lot of conditions, other conditions, or not. It doesn't mean that just because you have migraine, you're going to have all of these, but it also doesn't mean that if you have migraine, you're not going to be suffering from any other conditions or not living with any other conditions. In my practice, most of my patients have issues with GI. So if you are experiencing this, please let me know. If you are going, there's also the anxiety. So anxiety and depression are very, very common, but I get this pushback saying I'm not depressed, and it doesn't take away from one condition or put emphasis on one condition over the other. It just says that you're more prone to have more than one because of the nature of migraine. A migraine that is unexpected, that you don't know when it will start, when will it end, might be something that causes anxiety. And that is normal, that is okay, that is expected. And over a long time, if it becomes even more painful, if it becomes more recurrent or happens more often, then I would expect that your mood will be affected, and that is normal. And what's interesting about migraine and these comorbidities, we found that especially in mood disorders, it's a bidirectional relationship, meaning if you fix migraine, your mood might get better. And if you fix your mood, possibly migraine can get better, because that anxiety could be a trigger for you, and your mood could be a trigger of worsening mood. Gynecological is another one, and that is a big one because of the hormonal migraine that we see with a lot of our patients. And sometimes there are other conditions that accompany migraine, and it's a very good idea for you to identify other comorbidities, and I'm going to say why. Other than the importance of you being treated as a human being and not as a disease, or not as a condition, it's very important that we understand what else is going on in the body, and if actually addressing one of the other conditions will help with you managing your migraine. So do we have anybody saying what else they're living with, if they are also living with other conditions? Are people still shy? I can't see the... Okay, so how can we as pharmacists help people living with migraine? We have something called medication review, and a medication review is the pharmacist has the ability to look at your medications and find out if there are any medication or therapeutic issues that can come out. Meaning, are there any side effects that can be handled and can be actually reversed or prevented? Are there any drug-drug interactions that make some of your medications work less or even work more and cause these extra side effects? Also, to look at when do you take your medication and how you take your medication. And your condition, is the medication that you have received the best option for you? We are trained, or wherever we are in the world, we are trained exactly in the same way, where we are able to do a medication review. So if you feel that you have more than one medication, it's a good idea always to go to your pharmacist and say, look, this is my list. How can I make my medications work best for me?
Heba, we have a comment. Somebody has IBS, pelvic floor dysfunction, and terrible dry eye and insomnia.
Yeah, you're a human being. You have all these organs. It's not only going to be pain in your head. So thank you very much for sharing your experience. And that is the experience of my patients as well. And when I work with my patients, I always say, tell me what else is happening, because if you have dry eye and the medications, one of the preventives that we do recommend causes dry eye, that's not going to be a good idea for you. Then I'm going to make sure that I give you something to manage the dry eye. If we have no other option, then I will also be able to help you manage the dry eye. And it might be something that is prescription, it might be something that is over the counter. IBS, as I said, this is usually the most bothersome for people living with migraine, other than the anxiety and sometimes the depression. Thank you very much. Now, I'm sorry. So when we talk about acute medication intervention, this is my favorite, because it's the easiest thing that I can do to help someone living with migraine. A lot of, like 60% of my patients come in with a lot of nausea and vomiting, and they are never, ever told what to do about it. They are only their physicians or their specialists or their family physician just focus on the headache and forget that this nausea and vomiting can be really, really bad. And I did have a patient who told me, I only get relief when I throw up. And while fine, in the end they do get relief, but can you imagine if you're driving a car, if you are on a train, if you have a life as well, you don't want to be having these negative experiences as well. That is not healthy at all. So nausea and vomiting are the number one and easiest way that we can help. If you have nausea, it means your digestive tract is going upwards. So even if you take acute medication, or if you take paracetamol, or if you're taking an ibuprofen or even a triptan, it doesn't get absorbed because your stomach is going out, your digestive tract is going upward. So there's delay in the absorption and in the medication making it to where it needs to go, because the body is trying to expel it. That's what nausea is. And managing that helps us actually get faster onset of your acute medication. And it's something that can be managed with something over the counter, can be even some ginger tea. It depends on how severe it is for you, but can also be a prescription medication that we can communicate to your doctor and say, we advise or we recommend that we start on an antiemetic or something that is an anti-nausea medication that might help both with the symptom itself and the absorption of the medication. And believe it or not, 100% of time, the doctors don't say no. They send me a prescription. I make sure that this medication does not interact with anything else they do. So they really appreciate it when I'm able to give them a recommendation as well. So talk to your pharmacist if you do have nausea, see what option you have. We also have something called medication overuse headache. And I know that a lot of you have been watching these talks often. So I'm going to assume you know, but I'm also going to assume you don't. So I will just explain quickly. A medication overuse headache, when I went to school, and I'm a little bit old, they used to call it rebound headaches. And rebound headaches, meaning that you take the medication, your body gets used to it, and when you stop it, the body starts to demand it. And it becomes dependent on it. It's a kind of dependency. And how does it show that it needs it? By giving you a new headache. So one of the best things that you can talk to your pharmacist, if you feel that your medication, if you don't take your medication, you're taking your medication too often, and there are a number of days that were kind of designated as the when do you know it's a medication overuse headache, the best thing to do is to talk to your pharmacist about, am I able to cut down? And do I need to start on something else to help me cut down on these? And if I cut down, usually if you are able to cut down and you start again to take medication, your headaches don't get as bad. But it's a process, and the pharmacist can help you do that. Okay. Now, prevention is one of these things that we can help you. If you are in medication overuse headache, it's not your fault. It's because you are getting headaches. Your only option is to actually take medication to help you with that headache. And prevention is a way for us to ensure you do not get the headaches, and this way you will not need your medication, and you will not get into this rebound or vicious cycle of, I am in pain, I get medication, if I don't get the medication, then I get the pain, and that becomes a cycle that is really not helpful. So one of the best ways to ensure that you do not need medication is not to get a headache to start with, and that's called prevention. And a pharmacist can look, as I said, at all of your medications, can look at other conditions that you live with, and can recommend a preventive for you. That preventive should, to know if something works for you, it should do two things. The first thing, it's going to reduce the number of days that you do get a headache. And the second thing, it needs to reduce how severe they are. So I do have some of my patients, they come in with 25 days of headache. And that's a chronic headache, is what we call it. And we start working with a preventive, and they go down to 20. And they go like, oh, it's not working. It's from 25 to 20. And then we talk together and we find out that it went from an 7, 8 severity, and it became a 5, 6. So they tell me, well, now I can leave. Now I can, I don't have to take a day off from work. I'm able to live better. It's not gone totally, but I'm able to function a little bit better. The best thing that happens is that you get to 0, but we don't see this very often. It depends on where you were, and we need to manage our expectations. So when you are from 25, you become 20. Our next step is trying to get you from 20 to 15, and then try to get you to a point where you do have these headaches, but you're able to have a good life. It's not about the headache itself, is not really the thing that we're trying to prevent. It's the improvement of your life, you being able to live as normal a life as possible, that we would like to provide you with. And I'm sure in Ireland, as in Canada, I see my patients more than anybody else. So when their lives are better, I'm the first one to see them come in the morning or come in the evening, and they can actually come and pick their medications, and I can see a smile. And that is a success. It's not the number. What number is it? Are they able to come in and be able to leave during the day because of the photosensitivity that happens? They don't need the glasses. They come in, there's a little bit of headache, but they're still able to open their eyes during the day. They're able to leave their homes during the day. The most wonderful thing happened in the past few years, and that is that we have new options. Historically, all the medications I had were, it was the what do you call, I'm going to think, I don't know if it's an Irish thing, the better of two evils. What would you call it? Is that like the least of two evils, or
yeah, either way, the best of two evils.
So it's just, am I gonna have really bad headache, or am I gonna have really bad side effects? That's how we were thinking of these medications that were not designed for headaches. They had side effects that sometimes my patients could not tolerate, and they did affect their quality of life. I had a few of my patients saying, I couldn't think straight. So I didn't have the headache, but I couldn't think straight. And how is that a success? That is not a success. A success is you being able to think as clearly as possible. Or I had the medications that were giving a lot of weight gain, and they were told, well, you need to lose weight. But they were given medications that were causing the weight gain and being blamed that it's, if you lose weight, then your headaches will go away. No, they were given these medications. And I know it doesn't make sense, and I'm sorry I'm laughing at it, but I don't mean, I just find it very kind of just weird that someone would be told to do something, but you're being pumped with these medications that actually cause that thing, and being blamed in the end for it. So today we have all these new medications that are really, really much better tolerated. They are targeted exactly that receptor that is causing the issue. They don't work in everybody, but we are trying them, and we're finding that they are improving the quality of life, and they're not causing the side effects. And if you stop them, then possibly you can try something else without having to, taper them off, wait, and then start something else. They are much easier for us to use. So we talked about when you have an attack, what do you do? When you have a preventive, when you want to not have an attack, what do you do? And now we're going to talk about lifestyle management and how pharmacists can help you. And as you know, a pharmacist, and I'm the first one guilty, we really don't want people to take medication unless they have to. We really want them to live their best life possible. And we always give non-pharmacologic or medicine-based advice based on improving your lifestyle. And lifestyle is very important for people living with migraine. The first thing that I tell my patients, start a diary. Start a diary for yourself, because you are you. There's only one of you in the whole world, and that you is best recognized by your own self, by you are able to look at your diary and know what you're feeling and how you reacted, and how did a medication work for you. So start a diary. If you take nothing out of this, please go talk to your pharmacist after you finish this. But if you get nothing, at least start a diary. It's also your record that you can take to your doctor. We do not have blood pressure machines that give us a number when we go to the doctor to tell him, yes, they are having a bad day, or yes, their blood pressure is not getting better with the medication. So we do need that document that shows the physician that these are the numbers. This is what happens when I take my medication. this is working, this is not working, and it will help them actually see in your real experience. And there's no, sometimes if I ask people how are your headaches, they go like, meh, I don't know what to do with that. But if they come in and they show me that I get 5 days every month, they are really bad and they're around my menstrual period, I'm able to actually give them medication that works specifically for that kind of migraine or for these symptoms, and makes these 5 days much better to tolerate. Sleep, exercise, diet, stress, headache diary, smoking cessation, hydration, trigger identification, all these are things that you can discuss with your pharmacist. And I do urge you to talk to your pharmacist. So we talked about a treatment plan. So if the pharmacist talks to you, they can always go back and recommend that treatment plan with an acute. Because one of the other things I didn't tell you about, a story with one of my patients, she was throwing up, and she was getting the headache go from 0 to 8 within half an hour. So she's nauseating. Even if she takes an anti-nausea medication, she throws that up, and whatever she takes does not work because it's too late, because the pain hits fast. So one of the things we decided to do is to give her a nasal spray. And a triptan in a nasal spray does not need to be absorbed through the stomach. If you throw up, there's no problem because the absorption actually happens in the nose. And she didn't need an anti-nauseant. And it works very fast. It works really, really well and very fast. And that solved the problem. So talk to your pharmacist about your symptoms and explain to them where your challenges are. And they will be able to do that and communicate it with your doctor. When I send a recommendation to the doctor, it's taken much, much more seriously than you walking in and saying, I read on Google, or I saw a TikTok. Doctors would accept it more, and you gain an ally who would push a little bit on your behalf and advocate on your behalf. And as I said, we really like doing this. We pharmacists do want to help people. We do not want to be counting pills and just handing you bags with your medications. We want to get to know you. We want to help you. That's what we went to school for. Lifestyle changes. I'm going to talk about supplements in a minute. And that is very important because in migraine, we know there are a lot of things that I see TikTok sometimes, and I worry that people think that if I put my feet in hot water, my migraine will go away. Well, I don't know. But I'm pretty sure that this is a neurological condition. If it helps one person, it's not going to help the millions of people. It's 1 of 10 children. It's 1 of 8 men, and it's 1 of 5 women who get this condition. If it's as easy as you putting your feet in hot water, we wouldn't be having this call across the world today to talk about this condition. So it's good. Try. I'm not saying don't try. It might, if it doesn't help, you're gonna have, if it doesn't help your head, you're gonna have nice feet and you're gonna have a nice pedicure if you can do that. But we need to not again dismiss and underestimate how this is a neurological condition, and your pharmacist can help you with advice. So a follow-up appointment is something I always tell my patients. I would love to see you again. If we did make recommendations and the doctor did accept them, they come back to me in a month, and they can always call me and ask me about side effects, about how medications are working, and I answer them on the spot. My phone rings in the pharmacy, I pick it up, and they have real advice, real fast when you really need it. So I'm gonna just ask you not to be shy and tell me if any of you take supplements. Please write in the chat. Are you taking any supplements that you were recommended, whether by your pharmacist or you read online or you researched yourself or whatever? If you are taking any supplements, please write in the chat, and we're going to see what is the most commonly used supplement. Okay, I have magnesium, I have Q10. Okay, that's it. So we have a few participants online. If you tell me, then we're going to talk about it, and don't be shy. Vitamin B, magnesium, and CoQ10. I have magnesium riboflavin. Yeah, okay, that's fair. Magnesium oxide. And is it Mary or is it Mari? You have to tell me how to say the name.
It's Moira.
Okay, see, I mean, so excellent. You said magnesium oxide, and I'm going to talk to you about different magnesium during this call. Perfect. So in terms of supplements, we know that supplements are important for people living with migraine. And we know that there are many different supplements that claim to be helpful in migraine. In Canada, we have all these supplements that say headache-free or something like that. And then when I look at the ingredients, they're just not, they don't have anything, and they don't have the doses that are recommended for headache management or migraine prevention. There's limited evidence in general. I was attending a conference today, and they were talking about supplements in children specifically, where we don't have enough evidence in children. So if you are living with migraine, you have a child who lives with migraine as well, we have very limited evidence. But some evidence exists for magnesium, riboflavin, or vitamin B2, and CoQ10. And I'm very happy everybody online said this. And magnesium glycinate, riboflavin. So perfect. Nobody told me anything outside of these. We do have some others that I can also recommend to you, but let me just quickly run over the three that everybody has written there and that we know there's some evidence. So well done for being on these supplements. Magnesium can prevent migraine attacks. It helps with muscle spasms. So if you get a lot of cramping around your period, then that's one of these things that magnesium does help with. Or if you have the stiff neck, if you have muscle pains and aches, this is a very good one. It does improve mood. It helps with sleep. And I love magnesium, even for people not living with migraine, but specifically for people living with migraine, because it works on something called restorative sleep, meaning that you wake up not feeling as tired when you have magnesium supplement. Bowel movement, not all formulations, certain formulations. And I'm going to tell you which ones. And then the dose recommended is where I would like you to take care of. So the recommended dose according to clinical studies to actually help with migraine is 600 milligram daily. Most of my patients are not taking this when they come in. They come in and they have 200, 300, they don't reach 600. So if you're going to, if you are on magnesium and you can tolerate it, you have no issues, try to go for the 600 and see if there's any effect. And that's why you need a diary, because then we know what it was before. When we start the 600, we will see if this helps. You can take it all in one go with supper or dinner. Do you call it supper or dinner?
We have both, but
maybe I don't know which one is which.
Dinner's usually earlier and supper is before you go to bed.
So this is before you go to bed. So dinner is not, you don't take it too early. Some people get drowsy with it because of the sleep. It's relaxing and it might help you go to sleep easier. The second one is vitamin B2. And it works as an antioxidant, fighting damaging particles in the body known as free radicals. And several studies suggest that people who get migraine may reduce how often they get migraines and how long they work. In one double-blinded placebo-controlled, meaning they gave them pills that were empty, they found that it does cut the number of migraine days in half. How many did they have to start with? I think if you haven't tried it, it's a very good idea. Usually we split the dose. So I was trying to tell you with magnesium, you can take it all in one go, or you can actually divide it depending on how much you tolerate it. CoQ10, that's a really, I could see also in the chat, they said CoQ10. So CoQ10 is also an essential player in mitochondrial electron transport chain and energy metabolism in the brain. There is there is this theory that it is an anti-inflammatory. So it's like your body's built-in ibuprofen that is in the background to reduce your inflammation. And they found that people who live with migraine who took 100 milligrams 3 times daily, which acts as the body's energy producer, had fewer attacks in 3 months. All 3 together can be taken. And again, I saw some supplements that put all 3 in one capsule and they divide it over the day. So you take 1 capsule 3 times daily. Taken together, if you want to know if one supplement works for you, you need to take it for 3 months. I don't recommend that you take all 3 together. So you start with 1, lead up to the maximum dose, see if it works, and then you add another one, and then you try to see from the time you started. If you start to have side effects, reduce the dose. Don't eliminate altogether, but just reduce the dose. So remember, I told you I'm going to tell you how to choose your supplements. The ingredients, reading the ingredients is very important. Try to find supplements that have the least number of fillers. Lactose-free, gluten-free is very important for people living with migraine. I find a lot of my patients have some intolerances, and there are supplements that are cleaner than others. So if you see a lot of ingredients in there, it needs to be as little as possible. So if you had to choose, put 2 next to each other and find the one that has less fillers than the other, because then it's less allergenic for you. Non-GMO, I don't know if Ireland has GMO. In Canada, we have something called GMO is genetically modified. So a lot of these have fillers that are genetically modified, and that is not a good idea. So we need them to be as clean as possible. Do you have genetically modified?
Not so much in supplements or anything like that at the moment, but I know it's probably something that will creep in.
Yeah, but if you're importing from the US, look for non-GMO on the label. Do not accept GMO on your label. Find the supplements or that has one of the studied proven to help formulas like magnesium citrate or glycinate. Oxide is somehow used in the US. In Canada, we only have guidelines saying only citrate and glycinate. Do not avoid oxide, because oxide might actually not get absorbed. Although it has the highest concentration of magnesium, the body does not utilize it. So you might not be getting the full value of it. Find a supplement that provides a maximum amount of elemental magnesium with the least number of tablets. So you don't need to pop 5 to get the 600. Find one that has less, because then you have also less fillers and you have less, less stuff in there. And consider the cost. You don't need to go bankrupt to take a supplement. And I love this. I'm going to show you this one that tells you the best magnesium. It puts all of these, but for us, we look at citrate, and I'm going to show you a trick, or I'm going to teach you a trick. How do you know if it's citrate or glycinate? So citrate is C if you get constipation. So those who have IBS, C. So citrate for constipation, because it does induce a bowel movement. Glycinate is if you have good bowel movement, you have no issues with your bowels, then glycinate is more neutral on your bowels. In Canada and the US, there's a big, there's a lot of requests I get around magnesium threonate, and it's threonate is there's few studies that were done in dementia, and it helps with brain fog. It's very expensive, but threonate for thinking. If you feel that you need to help with your memory, help with your cognition, you might want to try it. Because it's very expensive, I tell my patients, use some threonate and the rest use glycinate if you have good bowels, or citrate if you have constipation, just to see if it does help with your cognition. Very few studies, but it's there in dementia. The others are right there, but I do not recommend them for my patients. But this list is going to be available. You're going to record this and you can see it later. Any questions? I can see a lot of stuff in the Uh, Anything in the chat that I need to address, or am I okay?
I think it's I think you've answered everything. Maybe, sorry, maybe at the end you might talk about the formulation of magnesium, whether tablet or
Liquid.
soluble, something like that, maybe.
I can easily tell you that it depends again. Are you nauseating? Is the liquid going to be a lot of liquid, or is it going to be little? Liquid sometimes does not have, if you cannot find lactose free and the gluten free and all of that, then liquid sometimes is cleaner. But it depends. It depends. Does it have colorants? Does it have any additives? Does it have a sweetener? The cleaner your supplement is, the best it is for you. So read the ingredients and decide based on what you can tolerate and how you feel with your supplements. Does that answer the question? Is it okay?
Yeah, perfect. I think that's...
So now I come to lifestyle of how us pharmacists, although we are working with medicine nonstop, we really want you to live a good lifestyle and not need as much medication and do changes that are healthy, because the healthier lifestyle we have, the less is the need for us, or the easier it is for us to add on better lifestyle. So you start with one and then it becomes easier to add another one until we have a lifestyle that is healthier. So I'm going to ask you, do you feel that your migraine in the poll, do you feel that your migraine is affecting your lifestyle? And is it affecting the way you're able to have a healthy lifestyle? Are you able to exercise? Are you able to manage your stress as best as you can? Or is the pain making your ability to manage your stress less? Do you drink plenty of water? Do you exercise? We talked healthy, eating healthy. Do you feel that you are also eliminating food from your diet because you think it is food that you enjoy, because you think that it is actually affecting your headache? So if you tell me in the chat, we're going to go now to the next part, or the last part of my presentation, which is your lifestyle and how we can as pharmacists help you. Okay, so we're starting to see some. It affects every part of life. Too many late nights impact. Okay, yes. So I mean, I have a young daughter who is very young, and she wants to go out and party every day, like everybody in her age. And if you have pain and if you're going out and staying late is actually a trigger for you, then that is a lifestyle that is impacted. Every part of life, and I agree with you. It's not an easy condition. I can't socialize and I can't work, and this is really this, you're disabled by the condition, and you are a perfect candidate for a preventive. And I would suggest you do talk to your pharmacist and see if they can work with you and advocate for you to try and find the best option for you. Sometimes walking is impossible due to dizziness and disorientation. So I want to talk about, I am the pharmacist, but I am very much an advocate of it takes a village. If you're not able to walk or too dizzy and disoriented, you possibly need to be referred to a physiotherapist to help you with the dizziness and giving you a little bit of confidence as well. I have seen amazing results with patients who were not even leaving their house, and they got the right medication. They were referred to a physiotherapist, and I went with them to see them in the gym, try to run on a treadmill, and that was like the happiest day of my life, possibly, to see someone going from I'm at home in the dark and they didn't work, and they were going to the gym, and they said they got a job interview and they were starting a job. It took them a while, but working with a team is the best thing that you can do. Sometimes walking affects what I eat and drink, and I agree, because the triggers with food and drink have lost many days of work in the past from the same. Migraine causes stress, and stress causes migraine. And we talked about it. I don't know if you were there from the beginning, but we talked about how it's a bi-directional relationship. Physiotherapy did not help me. I think physiotherapy with the right medication might give you good results. And I suggest do not give up. Find a physiotherapist who does specialize in vertigo and in dizziness and is able and migraine. They possibly can find something. So don't give up. I think you will still be able to find someone who's able to help you. When one can't stand without problems, how can one walk? Okay, so again, it's something that we need to try to find you the right medication. There are medications now that might help you, and with a whole team, you will do best. Okay, so sorry, I got here. So lifestyle changes. There's a clinical study that was done, and they came up with, like, they looked at all clinical studies, not only clinical study. They looked at it and they did guidelines saying that it's called Seeds for Success. And they said there are these, so the seeds are the letters, it's a mnemonic for sleep. S is for sleep. We know that if you don't sleep well, you might have an issue with your with how well you are able to manage your migraine, and it can be a trigger. But a lot of my patients are not able to sleep because of the migraine. So we don't know which comes first, but we know if we fix sleep a little bit, there is an improvement in migraine. Exercise is another one, and I really love the comment. I can't see the comments anymore, but I love the comment of, if I can't walk, if I can't even stand up, how can I walk? You're absolutely right. We need to take one step at a time. And the research says if you just go straight into full force, you want to run before you can walk, then you will have actually worsening of your headache. The benefit you get is from that build up. And if it's a few steps in the beginning with the help of a cane, and then if you're able to walk a few steps, then you add a few steps every day. And again, that's the diary. Write down today, if you have stairs in your house, try to go up the stairs at least once a day and come down once a day more, and add one flight every day. If you have I don't know how the houses are in Canada. We have houses that have stairs, small stairs that you go up to your room. I advise my patients to go use the washroom upstairs every time they need it, because then we know that we've gone up the stairs more than we would during the day. Eat, and eat is hydration. As I said, we know that people living with migraine cannot tolerate dehydration, so you need to make sure you're very well hydrated. Make sure, and I have patients who tell me, I have a bottle next to me, I'm very well hydrated. Sometimes it's not just water, sometimes it's your electrolytes. So if you're not if you don't have enough electrolytes, that might be affecting your headache. So make sure that you do also have in the middle of a migraine attack, try to use an electrolyte solution and see if that helps a little bit. Triggers that are food triggers, you are the only one who can tell me what your triggers are. I cannot tell you what they are. And I've heard from my patients some things that I would never have thought they are triggers. Something like avocados, where we think that's the healthiest thing ever, turns out it's a very common trigger. Or citrus fruits. I would always put a drop of lemon in my water because I think it's healthier, but actually it's a trigger. So observe what you do, record it, and try to find it. One of the things people do is they do an elimination diet. So they remove everything and they start to add one by one until they find the one that actually creates a headache, but that might not necessarily be the case, because as I said, it's a neurological condition. But maybe if you improve your eating habits, you might get benefit. The best thing that I saw happen with my patients is when they did keto diets. So they reduced their carbohydrate and they reduced their sugar intake, and they were able to get very good results. The research is saying it's not maintained, but if you need that boost to get you going, maybe you can increase your protein intake and reduce your carbohydrates and see if that helps a little bit. It's not sustained, but maybe it's that boost until we find you that right medication. The other thing that doesn't do very well with migraine is if you skip meals. You need to take regular healthy meals, and the highest percentage of protein needs to be first thing in the morning. Don't go for a long time without food. Diary, I said, I think I've said too much, and I can see you're drinking. Thank you very much. And then stress. It was already in the notes. It was already in the comments. Stress does cause headache, and headache or migraine, and migraine does cause stress. And managing stress can be something that you need to work hard on. And I understand it's easier said than done. So just try to think of what makes you a little bit less stressed. Try breathing exercises. If you need to talk, and if you have the ability to get access to someone who will help you with cognitive behavioral therapy, that's a very good way. And there's a lot of benefit that we saw for cognitive behavioral therapy over actual medications, where you are able to manage the feelings, the frustration that you have, and the stress and the anxiety around, when am I going to have the next attack? Am I going to attend the wedding that I have lost all this weight and bought this beautiful dress for? Or am I going to be able to attend my child's Christmas party? All of this is also something that you need help with, and it takes, again, it takes a village. It's not only that you need to talk to a specialist or to talk to a professional. Surround yourself with positive people. Surround yourself with people who understand you. Surround yourself with people who support you and who've got your back, that will understand when you cannot make it, and they will fill in for you. They will drop you a meal when you cannot cook. Like, make sure, and that does help. And we found that people who surround themselves and try to explain it, because we don't always choose who's around us, but try to rally people around you and gain advocates. And pharmacists are the first people that would love to help you. So do talk to your pharmacist, explain your challenges, and I'm sure they will hop on your team and they will cheer for you to feel better. So this is the end of my talk. I hope I gave you an idea about what pharmacists do and what pharmacists understand about migraine. And I'm now ready to hear your questions, your feedback, your remarks, and tell me, what else can I do as a pharmacist to support you? Have I covered all my bases? Have I actually told you things that you think that I would benefit also from hearing? What else you think your pharmacist can do for you?